Chapter 8, the Skeletal System. Now that we've learned about the individual bones and how they're formed and their function, we're going to look at the skeletal system as a whole. For our exam, we do draw more from Chapter 7, but there are a couple of questions that show up from Chapter 8, so be sure to check out the Exam 2 review to really see which ones you should focus on. Our skeleton is organized into two divisions. The axial skeleton is made up of 80 bones. These include the skull, the vertebral column, which is your spine, and the thoracic cage, the word that we use for your ribs and your sternum in front. This part of the skeleton protects your brain, your spinal cord, and all of your internal abdominal organs. The appendicular skeleton is made up of 126 bones, and it includes your shoulders, your pelvis, your arms, and your legs. The girdles are the pectoral girdle, which are your shoulders, that connect the axial skeleton to your upper limbs, and the pelvic girdle is your pelvis, which connects your lower limbs to your axial skeleton. Here we can see the skeleton color-coded for the axial and the appendicular. Red is the axial skeleton, consisting of the skull, the spine, and the ribs. And the appendicular is in yellow, consisting of our arms, legs, pelvis, and also those shoulders. When we're learning about the skeleton, you're going to see a lot of words you may not be familiar with, like meatus or fossa or tubercle. Now, all of these words, they're not just made up. They actually have Latin or Greek origins, and they describe surface features or bone markings. A meatus is a canal-like passageway. So if there's an opening in a bone that blood vessels go through, it might be called a meatus. A fossa is a shallow depression. A sinus is a bone cavity. A foramen is a hole. You're going to see that one a lot. And there's many more like condyles or processes. Memorizing this chart will help you a lot with being able to answer these on the lab practical by having a really good understanding of what those markings would normally be called. This chart gives us some details. The articulating surfaces, depressions, projections, they all have different names, and there are specific descriptions of what they look like. Your skull is formed by 22 bones. It's organized into the following. The cranial bones form a rounded cranium that surrounds and encloses the brain. The facial bones form your face. These are the entrance to the digestive and the respiratory system. All right, here we have a picture showing us the difference. From the side, we're able to see that there are the rounded cranial bones, the occipitals on the far left, followed by the temporal and the parietal, and the frontal. Deep inside, we have the sphenoid and the ethmoid, but these are all going to be considered the cranial bones because they form that protective case that keeps your brain from having concussions all the time. This picture shows us what it looks like if we take off the top of the cranium and look down. This is the base that your brain is going to rest on. A very important bone is right in the center called the sphenoid bone. This bone actually connects to all the other cranial bones. It helps hold the base of the brain, and at that little spot called the sella tertia, that's where your pituitary gland is going to sit. Your bones include your frontal bone, which is your forehead, the two parietal bones. These are the roof of the cranium on the left and the right side. The two temporal bones are on the side of your head, close to your ears. This is also where we have the external auditory meatus, or the opening to your ear, and the zygomatic process, which is going up towards your cheekbones. The occipital bone forms the back and the base of the cranium. The sphenoid bone is that one that's inside of the skull, where it connects all the rest of them. And then the ethmoid bone is a tiny bone towards your nose. That's it for the cranium. We just had those 8 bones. That means we have around 198 bones more to go. Don't worry though, every single bone does not have a name. Some of them just have numbers. On to the facial bones. There are 14 bones that make up your face. Most of these bones come in pairs, with only the mandible and the vomer being single bones. The rest have a bone on the left side and a bone on the right side that fuse together at the center. One of the most important bones for talking and eating and everything is your mandible. Your mandible is your lower jaw. This picture gives us a good idea. It's all of those teeth on the bottom and the connection up to your skull. The mandible holds the lower teeth, it forms your chin, and strong muscles attached to it to allow for chewing. It is the only freely movable joint in your skull. No other joint in your skull should be wiggling around, just the mandible. The maxilla is this bone shown here in pink. It is your upper jaw. It holds the upper teeth. It forms the roof of your mouth, part of your nasal cavity, and also the bottom inside section of the eye orbits. The maxilla is formed from two bones that are fused together at the midline. Flipping the skull over to look inside the mouth, at the roof of your mouth, there's a small section in light pink here at the back called the palatine bones. These are, once again, two bones that are fused together at the midline, and they form the posterior part of the hard palate. You may have heard of a cleft palate. A cleft palate is when the palatine bone and the maxilla, or just one of them, fails to fuse. Whenever that happens, the midline fusing does not occur and an opening exists between the two bones. If that opening is severe enough, then a child is not going to be able to produce suction when nursing. And if it's very severe, that cleft palate will continue through the maxilla all the way up to the nose on front. These can be repaired surgically. A very small one might just fuse as you get older, but if they're large enough, then only surgery will be able to completely close them. Here are some pictures of a repaired cleft palate. On this patient, it must have been that the palatine bone and the maxilla bone both failed to fuse. So the stitching goes all the way up through the hard palate and out to the upper lip to close it up. And over time, this heals and you can barely see that there was once a cleft palate. Continuing on with the facial bones, we have two bones called the zygomatic bones. These are your cheekbones. If you've ever been told that you have beautiful cheekbones, they look wonderful, then you really should stop them and say, "No, I have beautiful zygomatic bones." You might get a weird look, but you're being accurate. Your zygomatic bones are shown in blue on this picture. If you smile real big and feel for that bump of your cheekbones, you're going to find your zygomatic. It also forms part of the eye orbit on the outside. Whenever we show you the skull, you may notice that there are some empty spaces, but when you're over here feeling your cheek, you're not feeling a bunch of empty spaces around the zygomatic. So what's going on? You actually have large muscles that come from the cranium or from the lower side of the mandible, and they connect underneath the zygomatic bone. So that raised section is protecting all of the muscles of your face, also allowing a site for attachment. So we have large muscles going underneath the zygomatic, and we have muscles attaching to it as well. The lacrimal bones are these two tiny dark green bones on the inside of your eye orbit. It's through these bones that your tear ducts run. It's through these two tiny bones, one on each side, that our tear ducts run. The word lacrimal is derived from a Latin word for tears. The small opening through the lacrimal bone connects to a lacrimal sac that drains into the nose. If you've ever been crying and your nose just starts running and it won't stop, well, you're experiencing that overproduction of tears in the lacrimal gland. On our picture, it's shown to the upper left of the eye. The tears are produced in the lacrimal gland. They wash into the eye itself, and some of that runoff collects on the inner eye and goes through the tear duct into the sac that drains into our nose. Then we have the tiny little nasal bones. These guys are really good to get asked on the practical because for some reason they're just really easy to memorize. But the nasal bones are shown here in white. There's a left and a right one that are once again fused on the midline. But they form the bridge of your nose. Past this point, your nose is going to just be cartilage. This is where the bone ends for your nose. Turning the skull back over and looking up at the roof of your mouth, there's a tiny area back here that's orange. This is the vomer bone. The vomer bone forms the posterior part of the nasal septum, or the bone that divides the nasal cavity into a left and a right side. So this is the best place to see it from, is that little bright orange bone. It's small compared to a lot of your other facial bones, but it's important for breathing. Your nasal septum can actually get pushed too far to one side or the other or damaged, but the back side of it, the vomer, is typically okay. There's another nasal bone that we typically wouldn't think of when we're thinking about facial bones, but it actually counts as its own bone. It's called the inferior nasal concha, or conchae. It forms the posterior part of the nasal septum. If you want to get a good view of the inside of a nose and see this bone, you can go to this YouTube video. It actually takes you inside of the nasal cavity so you can see it better. Now, sometimes if one of these conchas begins to swell, say it's the intermediate or the superior one, if it swells too much, it can actually push the nasal septum to one side. This picture shows us a frontal view of a face. We see the eye orbits and we see the nose. And one of those concha got so big, it pushed the nasal septum over. So this would have to go and be repaired surgically. In addition to the bones of the cranial and the facial, we're going to talk about something called cranial fossas. These are curved depressions in the floor of the cranial cavity. The lobes of your brain, there's kind of different levels. The front of your brain is called the frontal, and it's held and basically cradled at the bottom by the anterior cranial fossa. The middle section of the brain is held by the middle cranial fossa, and the butt of the brain, or the cerebellum, is held by the posterior cranial fossa. This is a view looking down into those fossas. Each section basically holds different parts of the brain, so they're all nicely cradled. Our brain is pretty soft and it needs to be supported very nicely. So if you do feel one of these skulls on the inside, it's nice and smooth and rounded to basically cradle that brain. With your skull, you really don't want these bones moving around. They're cradling the brain, they're protecting it, and even though we have joints, which is where those two bones connect, we do not want movement. The only movement in your entire skull should be your mandible, your jaw. So instead of having a typical bone joint that allows movement, we have joints called sutures. These are immovable joints between your cranial bones. At birth, these bones are joined by dense, regular connective tissue, but as you age, they fuse and close. Those sutures include the coronal suture, which connects the frontal bone to the two parietal bones. That one, if you're wearing a headband, would be like on the coronal suture. Then there's the sagittal suture. The sagittal runs down the middle on the roof of your skull between your two parietal bones, on the left and on the right. On the back, we have the lambdoid suture. That connects the two parietal bones to the occipital bone on the back. And then we also have the squamous suture. That's kind of a flattened suture on the side connecting the temporal bone to the parietals.